Joining Ryan are some of his colleagues. We've got Sharon, who is a careers officer with NHS. We have Jude, who is a management accountant, and Chrissy, who is an education contracting manager. They're just slightly out of shot at the moment, but they'll be joining us later for the Q&A session at the end. Before we start, there's just a few ground rules and suggestions. Please make notes as you go along in case there are any questions you would like to ask. We will be taking questions at the end, so please chat in your questions. We will try and answer as many as we can within the allocated time. Otherwise, we will collate the questions and answers and forward them on to you. There's no need for you to have your webcam or audio on. You'll only be able to hear and see us. Over to you then, Ryan.
Thank you. Hi, my name is Ryan. I've worked for the NHS for over 10 years now. My current job is an information workforce manager. I've started in the NHS after graduating from uni. I studied information systems and business studies. My first job was working in risk management as an admin support, and then I progressed through the system into a senior management position. So today I'm just going to give you a talk about NHS careers. I'm going to start the presentation with some interesting historical facts, and then we're going to have a quick quiz. We're going to talk about job opportunities within the NHS, and then finish off with some questions and answers where I'll bring in some of my colleagues for their assistance. So, the first slide. In 1948, the Health Minister, Nhs Bevan, established the NHS. If you haven't guessed with a name like that, he was clearly Welsh. It was the first time healthcare was free for everyone. However, 4 years later, the government introduced charges for prescriptions, which infuriated Nhs Bevan, which ended up leading in him quitting his job. In 1958 was the first mass vaccination programme. It was for polio and diphtheria, and this vaccination is still ongoing today. So, you know, the injection you get in your arm when you're 14, that's the last booster for those diseases. The polio vaccination was so successful that there hasn't been a case since 1984. In 1961, the contraceptive pill became available, giving women control over when they wanted to have children and how many. And in 1968, only 50 years ago, remember, it was the first UK heart transplant. It took 7 hours, 18 doctors and nurses, but unfortunately, the patient died 46 days later. This wasn't attempted for another 10 years. So, you know, now there's over 200 UK heart transplants carried out each year. So the next slide. Okay. In 1972, CT scanners were invented. Now, these devices revolutionized the NHS. So they essentially allowed doctors to view a 3D image of a person's organ without actually cutting into the patient. In 1978, Louise Brown was born. She was the first test tube baby, giving millions of couples who were unable to have children new hope. Since then, 5 million babies have been born through assisted reproduction worldwide. In 1994, a new computerized donor register was created. Before this, the NHS had to rely on people carrying paper donor cards to say that they were happy to donate their organs if anything happened. And in 1999, 51 years after the NHS was established, Welsh Government were given powers over NHS budget and policy, meaning that we could now deviate away from, you know, England's plans. So this is my last slide on the historical facts. In 2007, one of the big decisions Welsh Government made was that they made prescriptions free again. So as you can imagine, Nhs Bevan would have been massively happy with that. So this means that if you need a prescription in England, it will cost you £8.40, but for you, your family, it's completely free in Wales. Another significant policy decision in 2011 was the Welsh Government was the first UK nation to introduce a system of assumed donor consent. So essentially this flipped the old system on its head. So now you have to actually go out of your way to say that you do not want to give your organs for donation, rather than the old system where you have to go out of your way to say that you did want to give them for donation. And now we've got a new health minister on getting, a young and dynamic man just like myself. So we'll see what happens. So that concludes the history lesson. So now it's your turn to tell me what you think of when you think of the NHS. So we'll give you a couple of minutes to tap in some answers. We'll have a look what you come up with. Oh, they're flowing in, are they? Yeah.
Yeah, we got a couple of typing now, so. Maria says the first public healthcare system worldwide. Okay, thank you.
So the doctors and nurses was on the list. Okay, cool. So there's no surprise that most of your answers are heavily influenced by what's on TV. So hopefully it will dispel some of those myths going forward. It's time for the quiz now. So unfortunately, we don't have any prizes, so we're just aiming for glory. So the first question is, across the UK, we have a big workforce. Where do you think we come in the world rankings? So bearing in mind this is not just Wales, but the UK NHS. Where do you think we come? We come 5th, 42nd, 91st. So if you think about companies like McDonald's and Sony, BP and Tesco's, you know, where do you think we kind of come in the whole world ranking? So I'll just give you a minute to pop in your answer. Have a good quiz. So it looks like half of you were right, with the answer being 5th. So the next slide shows you kind of the world rankings. So you've got US Department of Defense at the top and the Chinese Army. If you look, we are 5th, only just behind McDonald's. So if you just kind of think about that, you know, McDonald's being all over the world with all their shops, we're still, you know, we're not a million miles away from them. So that just goes to show the amount of resource and effort that we place in the NHS. So the next question is, we're the largest employers in Wales. So how many people do you think we employ? Is it 87,000, 70,000, 65,000? Give you a minute. Now we've got a spread. So the answer is 87. So I'll just put that into context for you in terms of, because 87,000 is a lot of people. So if you imagine the Principality Stadium, that holds 74,000. So if you were to put the workforce in there, it would completely fill every single seat, and there'll be people spilling onto the pitch as well. A lot of people. So the next question is, you might have heard on the news all the staff shortages in the NHS and all the pressure the NHS is coming under. How many vacancies do you think are posted on NHS jobs each month? Is it 10,000, 25,000, or 38,000? Keep the answers flowing. So a mixture with the most being the 10,000. 10,000 is a big number, but the real answer is 25,000. A lot of jobs. A lot of jobs that you could be having. As you can see, this is a map. This is a map of Wales showing the health board, how the health boards are arranged. The health board provides services from cradle to grave, and they service the entire population of Wales, which is 3 million. So the services within the NHS are kind of split into 4 main areas. The first one is primary care, so things like GP and dentists. The second is secondary care, like just your hospitals. Then we've got tertiary care, which are hospitals that have a specialist function, like neonatal or cancer care. And then finally, we've got services that are provided in the community or at your home. So the next few slides are about some of the activity that goes on in the NHS. This is per day. So I'll just pick out a couple of highlights from these. So there's 1,200 emergency 999 calls responded to, which is nearly 1 every minute. There are 50,000 people that see a GP per day. So that's more than the population of Bangor and Wirral combined. There's 600 people who receive treatment for minor injuries. This is a day, so there's quite a lot of people who are injuring themselves. And there are 10,000 x-rays carried out, which is more than 1 x-ray every 10 seconds. And finally, the final slide, there were 1,500 operations that are performed, and there are 9,700 patients that occupy an NHS bed. So that is equivalent to 22 Celtic manors. But I'm sure the accommodation there is probably a bit better than the NHS. So the final question is, have a look at the list on the slide, and can you name the jobs that are not in the NHS? So I'll just give you a couple of minutes just to tap some of the names, some of the job titles down. See which ones you get. So it looks like, you know, a lot of you have gone with what, tattoo artist?
Librarian.
Librarian. Anything else? All coming in.
Tattoo artists.
Yep. Okay, so the answer are, we're tricking you. They're all jobs, even the tattoo artist. So I was surprised at that, to be honest. So I did a bit of research. So we use tattoo artists. So if someone has a facial disfigurement, then a tattoo could help to improve their appearance. So therefore, the NHS would, you know, employ people to do things like that. So don't just think of us as clinical professionals. There are over 350 professions and a lot of them are non-clinical, but are equally as important to make the NHS run. So some jobs that you probably wouldn't have thought of in the NHS: there's gardeners, there's receptionists, there's plumbers, there's cooks, accountants, computer programmers, graphic designers. So basically, most of the main jobs that you can probably think of, we've got them in the NHS, plus more. So why would you want to work for the NHS? So for people who want to make a difference, the NHS is rewarding because either you're working directly with a patient or you're helping to provide a better service for the patient. For people who are more about the money, the NHS has a great pay structure. Normally you start at the bottom of a band, and then the next between 6 and 9 years you'll get an annual pay rise. For people who are more about the work-life balance, there are loads of flexible hours and patterns within the NHS, and you also get 5 weeks holiday, which is a lot more than a lot of other organisations. For people who want something for nothing, there are loads of NHS discounts available to you. If you look on the slide, there's tons and there's more than that. So for healthcare courses where you require a degree, we are able to financially help you achieve your goals. So unlike England, we will pay for your tuition fees, and not only that, we'll give you a means-tested bursary. And as we already talked, there are lots of jobs in the NHS that do not require you to have a degree. Once you're an employee in the NHS, we'll invest in you and help you reach your potential. So I'm just going to hand you over to Rhian.
Thank you, Ryan. What we're going to do now is we're going to have a little video clip of Stephen Griffiths, who works for NHS Wales, and he's going to tell you a little bit about his career journey.
I would never have dreamt 30 years ago, when I started off my nursing career, that I would be working on a national role influencing nurse and healthcare education across the whole of Wales. My first role was as a nursing auxiliary, or nursing healthcare support worker, we call people now, and that was just after I left school and while I was waiting to be accepted to undertake my nurse training. I worked as a staff nurse and as a charge nurse in clinical wards and environments, providing direct care to patients. And I was learning lots of new things. I wanted to apply that to the practice and the clinical areas I was working in, but also to apply it in a broader context into different wards and different departments. And the management role afforded me the opportunity to work and apply that knowledge and skills across different areas. I was very fortunate by working in the NHS. I was not only invested in through the education and support I had, but I also had a sponsor who guided and directed me and supported me in my career choices. But ultimately that resulted with me securing a post as the Executive Director of Nursing in one of the health organisations in Wales. And as such, I was responsible for the standards of care which patients received across the whole of the organisation. I was responsible for the professional standards. I was responsible for the advice provided to the board on nursing matters across the whole of the organisation. The NHS has invested in me, it's supported me, it's developed me, and it's provided me with career opportunities far beyond what I would have expected when I was 17, 18 years of age, starting out as a nursing auxiliary in my local community hospital.
Okay, can anybody hear me now? Yep, you can all hear me? Brilliant. Okay, we just jump back to that slide, and I'm really sorry about that. Right. Just bear with me again now.
Yeah, good to go.
Yeah, sorry.
So we've only got a couple of slides left. As you can see, I've been joined by the A team, who will be ready to field some questions. So as you already know from what I've just been talking about, there are loads of jobs in the NHS. The slide gives you samples of some job roles and associated bands. So, for example, a newly qualified registered professional like a nurse or a physiotherapist, you would expect to be starting at a band 5, which is 21,000. So it's not bad for a starting salary. And then this next slide is the bands for the senior managers. So this range, anything from 40 to up to 100,000. However, what's not listed here are salaries, the off-scale salaries that can be 100 plus. So, as you can see, there's a massive range of jobs. There's a massive range of pay. I think there's something for everyone here. So the final slide, I'm sure you'd be glad to hear. So I've talked about some interesting historical facts. I've talked about the size of the NHS, talked about the perks of the NHS, but hopefully the key point that you'll take away from this presentation is it isn't just about doctors and nurses. We've got jobs for everyone. So I hope you've enjoyed the presentation, and I hope you've learned enough about the NHS that you will consider us as a career choice. So, you got any questions?
Yeah, we've had a few questions coming in. One of them came in. One of the questions were asked, what functions do housekeepers fulfil? Can anybody answer that?
Well, they play a very important role in relation to keeping wards clean. So they help to prevent infection because they're cleaning the wards every day. They can also help with delivering food to patients at mealtime as well. So it's quite a complicated role now because of all the different chemicals they use in order to ensure that our wards are bug-free, which is best for the patients.
So if you ever really want to find out what a role involves as well, it's always a good idea to have a look on NHS jobs. There's a job description there and it'll outline key responsibilities as well.
Okay, we've got another question that have come in. If Welsh students study elsewhere in the United Kingdom and Northern Ireland, will the degree remain subsidised? Anybody answer that one?
With the changes in the bursary system that have occurred in England and in Wales, previously we were able to fund students that studied in England, but because of the changes and England no longer provides bursary support for their health professional students, it's now within Wales. It's only if you study within Wales and you agree to work once you've finished your programme for 2 years that you are able to access the Nhs Wales Bursary, which includes the funding of your tuition fees and £1,000 bursary and some other additional funding to support you during the time you're studying.
Thank you. We've got another one which is asking about accountancy. What career routes might there be to get into an accountancy role? Are there apprenticeships available?
To be honest with you, once you get into the finance department within the NHS, we would normally fund different courses depending on where you want to go. You'd normally start at an accountancy technician course, which is slightly lower level, but most of the band 5 finance jobs would ask for an accountancy technician qualification. And then you would go from there to become a qualified accountant, so you do, say, an ACCA route. If you've already already passed your AAT course, you would not have to do the whole of your ACA route. You would have you'd probably miss that first year if you become a qualified accountant, and then after that, you will join the NHS, you can move on. Not every university is network centred. Some universities do. We have one student with us at the moment who's studying in the University of South Wales. It's a 5-year finance course. She does 2 days in universities and 3 days work-based experience with us. She gets paid bursary each year that she's on the course, and then at the end of 5 years, hopefully she will gain her qualification, and then she will want to stay in the NHS as an employee.
Okay. We've a question in regarding work experience. Is work experience on a CV valued? And how important is work experience?
I'd say work experience is very, very important. If you visit nhswalescareers.com, there's a page on there about work experience, and then that links to each of the health boards and trusts that offer work experience. Sorry, if you can't hear me. Each health board sets its own criteria for work experience. So I'd say if one is perhaps not offering at that time, maybe look to another health board. But I'd say don't limit it just to the NHS as well. Look at volunteering with the likes of St John's Ambulance, also charities as well. Care homes is another great way to get experience, but all experience is good experience.
Right. Somebody wanted to know what each of you do, what your job roles are, maybe how you got into them, how you do it, what your job entails, basically. So do each of you want to do a brief description of what you do?
Okay, I start. I'm Chrissy. I started life as a student nurse a long, long time ago. So I worked in St Wales Hospital for a number of years. Then I also worked in a nursing home, and then I spent 19 years working in the Royal Great Hospital within orthopaedics. I developed myself, and I really enjoyed education and having students. So I went off and I was lucky enough to be funded to do my teacher training. I then went into an educator role within healthcare, as it was then. I then progressed from that to a managerial role within education, and for the past year and 3 months, I've worked for Shared Services Partnership within Workforce Education Development Services, and I'm involved in the commissioning of health professional education. So I work with a number of other people, and we purchase education on behalf of Welsh Government for the health boards and trusts in order for their workforce to be trained, so that we have sufficient, or hopefully have sufficient people to work within our hospitals and other areas within the NHS. That's what I do now.
Okay. I started off in an administration role within the Welsh Government after my A-levels. I moved from there, we were transferred into the NHS, and I kind of fell into a finance role. So I started kind of from the bottom and worked my way up. As I kind of went through my career, I decided I did quite enjoy it, and I wanted to follow this route. So I started doing the accounting technician course that I mentioned earlier. Unfortunately, between all this, I've had children, so it's taken me a while to get there. So I'm still not a fully qualified accountant, but I am currently responsible for an £85 million budget, which we get from the Welsh Government, and it covers the costs, as Chrissy was saying, for all the nurses, midwives, physiotherapists, etc., for them to be trained and we have to work within that budget. So, kind of me.
Okay. My career didn't start off in health. I'm actually a qualified teacher and I specialised in English for speakers of other languages. I decided that teaching wasn't quite the right fit, but I wanted to stay within education. And I came into Workforce Education and Development Services as a support officer, so did the administrative side. I did that for about 2 years, and then the careers officer post came up, and it seemed like a great fit because it brought together my interest of education as well and promoting the different careers that are available within the NHS. So that's what my role consists of. It's a whole Wales role, and I work very closely with colleagues in each of the health boards and trusts, but also colleagues in Careers Wales and Job Centre Plus as well, advising on the opportunities that are available.
Thank you. Another question's coming. What A levels should I take for a nursing career?
Ooh. You need to have some science, so biology would be a good A level to have. Maths is also very important, and so is English. You need that at least at GCSE level. But each university has some slight differences in relation to what they ask for. So the best thing is to look on university websites. So we've got 4 universities within Wales that offer nurse training: Swansea, Bangor, University of South Wales and Cardiff. And they all might have slightly different eligibility for entry. But definitely you will need something, a science at A level, plus your maths and English at GCSE level, and then 1 or 2 other subjects. Could be Welsh Baccalaureate or something else at level 3.
Does the NHS still fund videography training?
Yes.
Yep. Okay. And maybe we'll take 1 or 2 more questions. And how do you get sponsored to study medicine in Wales?
Well, medical degree is a normal UCAS application, isn't it? Yeah. So the actual undergraduate degree is not funded by us. It's a traditional student, so it's loan. It would be loan because you'd have to pay your fees. But then once you've got your medical degree, you would then enter into the deanery area, the postgrad, where education would then be supported and funded. So the deanery sits inside Cardiff University at present.
There's another question about work experience. What work experience is available in the NHS for GCSE students wanting to become a nurse or midwife? Is it easy for them to get work experience placements?
As I was explaining earlier, it really depends on the individual health board or trust because they set their own criteria. So I would say visit the NHS Wales Careers website, give you all details of how you can apply and the criteria for doing that. But another avenue you may also want to explore as well is volunteering. It's another great way of getting experience.
Thank you. All that's left to do now, I've got a little poll, and if you wouldn't mind just answering some of the questions. So I'd like to thank Ryan, Chrissy, Sharon and Jill for coming along today. As well as the online poll, there will be a paper evaluation that will be given out to you either by as a member of staff there with you, a careers advisor, a teacher. Otherwise, we'll send it on to you, we'll email it on to you. And if you can complete that and send it back to us, we'd really appreciate your feedback. So thank you again for joining us. I hope some of you have had some of your questions answered.
Bye.